asked nicely. I asked her. Stop.
Postpartum mental health encompasses the emotional and psychological challenges that new parents face after childbirth. It's crucial to recognize signs like persistent sadness, anxiety, and changes in appetite. The stigma surrounding these issues can prevent seeking help, but early intervention is vital. Parents should embrace self-care, lean on support networks, and explore calming techniques. Remember, sharing experiences fosters community and healing in this journey. Postpartum depression is a serious but treatable medical condition that can affect women after giving birth. It can cause feelings of sadness, anxiety, and exhaustion, which can make it hard to care for yourself and your baby. Symptoms: persistent sadness and low mood, loss of interest in activities you used to enjoy, difficulty sleeping or sleeping too much, feelings of worthlessness, shame, or guilt, thoughts of harming yourself or your baby, recurring thoughts of death or suicide. Risk factors: having a history of anxiety or depression, experiencing gestational diabetes, being younger, and having less education. Treatment: medication, such as antidepressants, mood stabilizers, or antipsychotic medicines. Talk therapy, such as cognitive behavioral therapy, CBT, or interpersonal therapy, IPT, support groups. Electroconvulsive therapy, ECT, for severe cases when to seek help. If you're experiencing symptoms of depression that are severe or last for more than 2 weeks, you should seek help. Support: having good social support from family, friends, and coworkers can help reduce the seriousness of postpartum depression.
But look at you. Look how far you've come. You faced your trauma, and you came out on the other side. And I'm sorry to get a little emotional, but there were some times there when I was really worried about you, Miss Girl. Look at you today. I am so proud of you.
I think more men need to educate themselves about a woman being pregnant. When a woman goes through pregnancy, they change all different emotions, and it's a 50-50 between life and death when they goes to give birth to that child. So I think men should be more appreciative of their pregnant girlfriend, pregnant wife. Postpartum is not her fault. The level of estrogen in her body quickly drops, and that allows the chemical in her brain to shift. So she definitely is going to go through mood swing. She have no control over her mood, and I think we as men should appreciate and sympathize, empathize with a woman who's going through postpartum, because even men can go through postpartum too. So I think a lot of men doesn't really understand that a woman lose 17 ounces of blood while giving birth, and all of this will affect her. Her body is changing. She'll probably start to have self-esteem issue. Worse when she's looking at her belly or stomach and she really wants it to go down. So a lot of things that is affecting her emotionally and also mentally. So I just strongly believe a lot of men should educate themselves and women being pregnant so they can appreciate them more. I have seen postpartum reach as far as a woman want to harm herself, and she also try to harm the baby. This feeling of sadness, hopelessness will all come over that woman who is going through postpartum. And that's why it's very important that they're closely watched, and you have to be very much attentive. So it is very much important to understand what they're going through. And as a man, we might not agree, or a family member who's around a woman who's going through postpartum with her behavior. But we have to just understand that it's not really their fault. It's just something that affects the brain that they experience, and we just have to be as supportive as possible.